30 plus years, I had very little exercise from probably the age of 25 to 55. Through my whole career, really pretty much, I was either sitting at a piano, sitting at a recording console, going out with artists or doing whatever, but it involved a whole lot of sitting. Golf was my main activity outdoors. The rest of the time I was making music, and that's not exercise. In 2014, I went into the hospital, realized I'd had some failing kidneys. So I immediately found a match. It was my wife, which is great. So I did to do some dialysis for 9 months. Got the kidney transplant, all was great. I was a new man. I felt 100% better. 3 months after my kidney transplant, I go on a golf trip, and I developed some kind of a little blister on my toe, on my right foot, and it never would heal, and it just kept getting worse and worse. And I went to visit my doctor at the time, and it was a podiatrist, and he realized that it didn't have enough blood flow to actually heal the wound, and then the wound got infected. A balloon below my knee, and it still didn't heal. The balloon didn't put enough flow down there. So I did research to find out that there was a particular surgeon at Mayo Clinic that could do stents below the knee. So I went to see this person. He stented it, and it healed. Well, the same thing happened to the left leg about a year later. And that is when I did some research locally and found that Dr. Fisher and Dr. Lee did the same stenting that I'd gotten at Mayo. And so they looked below my knee, and the peripheral artery disease had set into my legs.
Mark had a history of diabetes and kidney disease. He had previously had an ulcer on one leg and had been seen by 2 vascular specialists prior to me who had worked on his leg. And then he went on to develop problems with his other foot. That leg caused a lot of problems, and that took several months to get that better.
I came to these guys here, and Dr. Fisher and Dr. Lee, that together they basically saved my foot.
We know that amputations, that's a bad outcome. In every case, we can't save a limb. We're going to do virtually everything that we can to avoid that in our patient population. And I think that they certainly appreciate that.
These guys are awesome. They were really good at what they did, and they knew exactly what to do. And they've stented my left leg now, so I've got good blood flow. I just went to the doctor yesterday, and everything is really, really flowing well.
There are a couple of things that patients need to keep in mind when it comes to preventative care and keeping limbs on and treating critical limb ischemia. The first thing is knowing what your toe flow is. It's a very simple concept, but how good is the blood flow going out to your feet?
You need to be very attuned to what's going on with your legs. If you start having pain when you walk, if you've got an ulcer or pain at rest, those are things that you need to seek medical attention for, and don't put it off. We want to get to it before it's too late.
Unfortunately, unlike cancer care or how we treat heart attacks, critical limb ischemia doesn't have many established protocols, and the awareness in the community is not as high as it is for, again, other disease processes.
Try to make progress every day. I'm really pleased with it. I mean, I get around great, and I'll tell you in about 3 months how my golf game is.